Good afternoon, everyone. I hope you're able to grab something to eat at lunch and network. So we're going to start up the show again, this time with the Startup Showcase. So Giant Health is proud to champion new innovators in our Startup Showcase. Today we'll be welcoming PCOS and Us to the stage, specifically Arti Janvari, who is director of PCOS and Us. Please join me as we welcome Arti to the stage.
Hi everyone, good afternoon. My name is Dr. Arti Janvari Mehta. I'm the co-founder, along with Dr. Dana Saeed, of PCOS and Us, which was founded in November 2022 in the United Arab Emirates. So PCOS and Us is a women's health company that provides structured, doctor-led lifestyle medicine programs to help support, guide, and improve outcomes in women with polycystic ovary syndrome, also called PCOS. We do not believe in fad diets, we don't believe in restriction, and we definitely don't believe in a one-size-fits-all. Sorry, I don't think that works. Oh, here we go. Okay, so for those of you who haven't heard about PCOS, it is the most common hormonal condition affecting women of reproductive age. It affects up to 1 in 4 women, especially in the Middle East and North Africa region. Simply put, it's a condition when your ovaries make abnormally high amounts of male hormones, which are normally present in small amounts. And the extent and the effects of it extend far beyond just the ovaries and the reproductive system. And we commonly hear about irregular periods, but it's a very complex pathophysiological process, which we'll touch on soon. The prevalence is rising. There are delayed diagnoses. Many women go undiagnosed, and it accounts for a huge healthcare burden. So just in the UK, it accounts for £237 million annually. If you have a look at the numbers on these slides, they're shocking. So you can see how it's a condition that creates a huge health impact. Conditions like type 2 diabetes, mental health disorders, sleep disorders, endometrial cancer, infertility, dermatological manifestations, all of these affect women with PCOS more so than the normal population. It is a condition that significantly reduces quality of life. But despite the huge impact that it has, from our own research and from the research out there, we know the management of this condition is subpar in clinical practice. So the current landscape of that of PCOS is one of lack of support, emotions of depression, disappointment, fear, isolation on diagnosis. There's really an overemphasis and a judgmental approach on weight, and more women are turning to social media and the internet for their main source of information. But that is not a blame game for the healthcare systems. As clinicians, we were simply not trained in medical school with respects to lifestyle, and we'll talk about why lifestyle is so important in the context of PCOS. And we have so many barriers in our current healthcare system. So one of them being time. Just in the NHS, our average consultation times are less than 10 minutes. We can't deliver lifestyle information in just that amount of time. So what do we need to do? We need to go back to our best practice guidelines, which is lifestyle intervention first. Why is lifestyle so important in women with PCOS? So PCOS is a condition that has a strong genetic component, but it also has very strong links with environmental components like lifestyle and environmental exposures. So this is where epigenetics comes into place, changing your lifestyle so that we can switch off those certain genes that are involved in the development and the progression of PCOS. This is where lifestyle medicine and management comes into place. What is lifestyle medicine? It is an evidence-based practice that addresses the root cause of chronic diseases like PCOS so that we can help prevent, reverse, and treat these. So it's based on 6 pillars: nutrition, movement, stress, sleep, connection, and substance abuse. So that doesn't mean it replaces medication, and it doesn't take the jobs of doctors or anything like that, but it is the first and the foundational step of management, irrespective of whatever else is added to the management plan. So our current studies show that there's a need for this. So studies show that we need credible doctor-provided information, we need PCOS specialists, we need awareness, education, support, and we need to address the stigma that currently prevails in the PCOS world. So that is what PCOS and Us does. We have created a one-stop shop for everything PCOS to not only provide a reliable evidence-based hub for women, but also to help support these women when they're waiting for their diagnosis or they're not able to see their doctors for more than 10 minutes. So we really focus on a few aspects in our 12-week structured lifestyle medicine programs. We focus on education. We work on all these pillars of lifestyle medicine, but we also have a very strong educational component of hormonal health and what PCOS as a condition is, the medications that are used for it, and we really provide that education for patients. And we also have a very strong positive psychology component because, as we know, positive psychology has huge implications within the management of health, right? We also provide accountability and coaching consultations so that we can help with our behavior change interventions, and we focus on support. We have peer-led and psychologist-led support groups and sessions to help women feel safe and to develop a space that is very empathetic and non-judgmental. So we focus on the few things that are missing in that 10-minute consultation and that are missing in the medical world. We focus on emotional and mental well-being. We really want to help patients improve their confidence, their self-esteem, and their body image. We have 2 tiers of our programs that we go through, and these really depend on what individual patient needs and requirements are. And why are we well placed to do this? So both Dr. Dana and myself are medically trained doctors, and we're board certified lifestyle medicine physicians. I have a special interest in endocrinology and diabetes, and Dr. Dana is a health coach, and she has a very strong background in positive psychology. So we've been able to work together effectively to create this platform and our PCOS community. So let's have a look at what our platform actually looks like. If we could start the video.
You sign up, you will receive access to the web-based membership portal that can be accessed on a desktop or a mobile device. You will then be taken to your program dashboard, which will explain to you how the program works and the main components. Here, I'm booking a one-on-one consultation with one of our physicians to help personalize my lifestyle management plan and support and health behavior change. I then have access to the educational course, which covers 16 modules on everything you need to know about PCOS and its lifestyle management, including mindset and positive psychology, nutrition, movement, sleep, stress management, addictions, connection, talking about environmental components or environmental involvement, in addition to supporting pregnancy and fertility and skin. So the evidence-based educational content is presented in bite-sized lessons, some as short presentations, video content, or audio content. We then have our PCOS toolbox, where you have a downloadable workbook which guides you through the program and helps you with setting personalized goals and getting familiar with the practices from the course. We then have our meditation and movement content, and this is provided by our women's health and wellness collaborators. And this consists of non-intimidating PCOS targeted movement in the areas of yoga, Pilates, resistance training, and we also have meditation and breath work on there. Finally, we've put together a hormone balancing recipe book that has delicious anti-inflammatory recipes to help support and guide your journey.
So that is just a snapshot of what our platform looks like. It's important to note that we're very much in our initial stages of our journey, and we want to validate and we really want to understand how our program affects women with PCOS. So we conducted a small independent pilot study with 36 participants over a 4-week period. We know that this is not a long enough time for us to gather clinical evidence or clinical data, but it simply allowed us to get a better idea as to how we can navigate our platform, the kind of content we can put up there, and then whether or not it's actually helping women qualitatively as well. So we found that the women on our program felt satisfied with the quality of the program, they felt educated, they felt empowered, and they found that it really helped them progress with their health goals. This is not even 1/100th of a drop in the ocean of what needs to be done in the world of PCOS and the amount of research that needs to be done. So we have a lot more work left to do. So we currently have within our platform, we've implemented validated questionnaires. So we've implemented the PCOS quality of life questionnaire as well as other lifestyle medicine questionnaires. And we want patients to take part of this at different points and times of their program so that we can get objective data as to how this program actually is affecting quality of life and the other clinical measures as well. So what does the future look like for us? We're currently vigorously looking out for partnerships and collaborations to help us with 5 big goals. The first is to really help develop and improve our patient user interface with a mobile app. We're really looking out to roll our program out on a larger basis and for us to gain more evidence when it comes to the objective measures of whether or not our program is effective. So we want to look at larger scale efficacy studies. We want to translate our program into Arabic to help optimize and reach our target audience, which is in the Middle East. So that's another thing that we want to do. And we're looking for clinical ambassadors where we want to really establish a referral pathway for patients who are newly diagnosed with PCOS. And we also want to work with women's health and wellness practitioners or any related services so that we can really develop the kind of services and the platform that we have and to expand our team. So I just wanted to leave you with a quote, which was from one of our patients. They said, "It is all invisible to you. All of this is happening inside you and you have no idea. All I know is that it takes a ginormous amount of effort to function some days." And I think this quote really resonates with the extent at which PCOS affects quality of life. So thank you for coming. We hope you stay in touch. We're going to be at stall D8, so we'd love to meet some of you and speak to some of you.